Another thing that's like kid dependent, some kids have pretty crowded teeth early on. Usually if baby teeth you already have crowding in your baby teeth, it's a pretty significant indicator that they most likely will need some sort of orthodontic intervention later in life. But if baby teeth are not crowded or have spaces, then it's a pretty good indicator that we might be able to monitor them for a while. Usually I'll say when kids get their 4 adult teeth in the front and their 6-year molars, when we take that panoramic x-ray, is when we first start to evaluate for possible need for orthodontics. And that being, if the canines are coming in at a pretty steep angle and if we're worried about anything being impacted in the future, or we're anticipating a lot of crowding along the way, then that's the time where we refer to an orthodontist for an evaluation. But an earlier on referral would probably be like a crossbite, or if we lost a baby tooth really early, we lost a lot of spaces, something that's kind of out of the ordinary that we're concerned about. But usually, if nothing else is kind of jumping out at us, is usually when we get the 4 front adult teeth is when we start to evaluate for ortho. And just because you get an ortho consult doesn't necessarily mean you need treatment. Because we're pediatric dentists, we train in a way that we know how to evaluate and refer when it's needed, but we don't necessarily do a lot of orthodontic treatment. So the ultimate decision is up to the orthodontist to say. They might put you on, a recall. They might say, come back once a year, we'll see how things go. And then if we need braces, we'll need braces in 3 years. Or they might say, you know what, you came at a great time, we should start treatment now. So ultimately it's up to the orthodontist, and our job is really point you in the right direction when it's needed.